Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Baldwin University. And in this podcast and video, I'll be going over how to bridge the gap between public and population health informatics. So bridging of big data to benefit communities. And this has often been a criticism for big data, is that how do you make it applicable to each discipline? How do you make it, how do you understand at a social level how this is affecting everything? So this was written by Roland Gamache and et al., two other authors. And so this was used by doing a search in PubMed search with the mesh keywords public health informatics, social determinants of health, social determinants of health again, public health, population health surveillance. So not too many words, but enough to have a considerable amount of articles. So over the last decade, over several decades actually, powerful forces have motivated the collection of health-related digital data in the United States and around the world. So the current U.S. healthcare's electronic data infrastructure has been designed primarily to meet the needs of medical providers, health insurance, billing, internal organizational management, and regulatory reporting. So it goes on to explain some of these things, the disconnection of data management aims across the healthcare continuum. So it goes through that, and then in the next paragraph, just going over how some of these health records need to be more uniform, and so one of the first attempts at integrating the clinical and public data to advance population health relates to the implementation of EHR-based surveillance efforts. So kind of bridging that gap between clinical and public data to advance population health, so the electronic health records need to be all tied together. So the so-called value-based policies of commercial and government insurance companies have begun to shift the focus of clinical organizations from individual patient visits to managing larger populations. So if you think about it, if you're able to manage a larger population, then that can cut down on cost. And so some of the risk sharing and fixed budgets for provider organizations, hence pushing clinicians to apply their digital assets. So then just continues onward. Methods, of course, this is a review, so a lot of different perspectives here have been brought together. So this is a good one, good figure. It goes over social services, population health informatics, public health informatics, and then data science, interoperability, and data exchange is what is at the center of it all. And then coordinating intervention, social. So this is a pretty extensive figure. I would encourage you to go through this, and then the results. They're categorized in different ways in different places. Population health, and then sustainability, which I've extensively researched and provided videos. This is in the recent literature, two areas were discussed within the topic of sustainability or digital initiatives. The first area identified was the importance of strategic partnerships within the community in order to achieve public and population health objectives using informatics tools. And so when you're looking at this for the improvement of the health status of the community, but they should also encourage stakeholders from outside traditional public health agencies to understand, to be involved in these processes. So this is meaning that you don't want to just have stakeholders for the sake of stakeholders. You want to make sure that maybe on the ground individuals can provide information for other types of informatics tools. So the second area of discussion concerned a stable funding source. So remember the first one that was stated earlier. And then the second area of discussion concerned a total funding, a stable funding source providing fundamental public health services. New models to provide for public health fundamental services will include both population activities and governmental public health services. So it defines public health informatics. This is a good paper to be going through if you're trying to understand social context and many different types of context. So this is a major hallmark sort of paper that has been published in 2018 in the IMIA Yearbook of Medical Informatics. So this is how this ends and provides some limitations of the study. Thank you for listening.